Okay, I think we'll go ahead and get started. Welcome again, everybody, to our Public Health Liaison Update and Check-in meeting on October 15th. My name is Mike Grant, and I'm with the Marin County Office of Education Rethinking Schools team. And we're joined here today by Dr. Lisa Santora, our Public Health Officer, and look forward to going over, providing an update and answering as many questions we can about the role of Public Health Liaison to support our schools and larger community. So we'll start with once again with a welcome to all of you. We all know within public health and within the school community that the public health liaisons have one of the most critical jobs to help support the safety of our students and staff and larger community in the age of COVID-19 as COVID still remains active in our world and community. So we appreciate you stepping forward and taking on this role, and we'll do everything we can to support you being successful and to address challenges and questions as they come up. So today's agenda, as usual, is Dr. Santora, our Deputy Public Health Officer, is going to give us an overview of where we are right now with COVID, going to provide some updates on testing, talk more about a very exciting announcement about our new Parent and Family Handbook and decision tree that has just been finalized literally today. Janelle, if she's with us, is going to give us a real-time response for the school bus scenario that we previewed last week, and we'll go into in a little bit more detail this week. I'll give a brief snapshot of where we are with our schools in the county today, and then we'll spend the majority of time trying to address as many questions and answers as we can. And I know that Ken Lippy, our assistant superintendent, sent out a survey this morning to the public health liaisons about the value of these meetings and if there's interest in continuing them. And I think so far we have a 100% response that our community is interested in continuing these. So we'll work with Dr. Santora and her team to try to schedule some ongoing conversations to support this work. So with that, I'm going to go to the next slide and hand it off to our Deputy Public Health Officer, Dr. Lisa Santora. Thank you so much, Lisa, for being here, and to you and your team.
Well, thank you, everyone. I do come bearing consistently good news. We just got off with the state again, and we have been orange, in the orange tier for 8 out of the last 9 days. And what that means is that because of one day, they check us on a daily basis of one day when we pop back up into red, that made us not qualified to move to tier 3 or orange. So we are cautiously optimistic again. Our data through to today continues to show us in tier 3 or orange. The state does not analyze the data until Monday. And so that's when we get a definitive statement, and we learned very early on that we need to wait until the state completes its final analysis and posts to its website our status. But I think what is reassuring for all of us is that when we first entered the red tier, we were much closer to purple. And again, our rates are consistently at 3.9 cases per day per 100,000 residents. That's where we've been hanging around. We just rounded up on that one, even when we popped into the red that one day, into tier 2 that one day, it was because we had 3.947. So we were really close on being in orange. So we're seeing a consistent trend. We spoke to the state. That's the trend they're seeing statewide as well. Santa Clara had a momentous event. It is now in an orange tier itself. And if you can remember, San Jose was ground zero for the COVID-19 pandemic as it hit the Bay Area. So we are moving forward. We're going to be presenting today a decision-making tree, which is going to be based solely on being in tier red or tier 2 or tier 1, red or purple. We're now developing a new decision-making tree that will ease restrictions not only for local businesses to increase their operations, but also when we're how we will be evaluating symptoms in staff and students. And that's because the fancy word we have is pre-test probability, or the likelihood if you were to be tested for COVID-19 and test positive if you have any of those symptoms is decreasing significantly because we're having less COVID-19 activity in our community. So if you do have any of those symptoms like cough or fever, which 2 of my children had today, and they're getting their COVID-19 tests, the probability, honestly, of their being COVID-19 positive is very low because we have lower levels of virus circulating in our community. I can't emphasize this enough. What we are seeing is we're seeing that it's those voluntary behaviors that are driving the cases that we are seeing in Marin County are among those individuals who are mixing households and participating in larger gatherings. And so really encouraging us, especially as we reopen schools, to stay vigilant. We are going to be sending a letter from Dr. Willis to parents, really articulating their role in staying vigilant and following state guidance, which now has explicitly stated that you shouldn't mix more than 3 households at a time. So there will be providing guidance to Marin County based on those state recommendations. And again, really trying to practice all of our protective behaviors. And last but not least, to get your flu shot. It's one thing, tried and true. I got my shot sore for a couple days, but that is what's going to protect our healthcare system. We are following what's happening globally, so we don't want to lose our guard. We want to keep our guard up and be prepared for any second wave. And that really depends on us working together. So that's it. Oh, this good news. So with San Rafael, one of the areas of concern, and everyone's been involved, has been the canal area of San Rafael, where we saw our highest % positivity rate of testing in July. Fortunately, and I think I've shared this before, we've seen the same declines that we're seeing countywide also happening in the canal. But prior to the launch, the reopening of San Rafael schools, we partnered with the school district to have more than 800 students tested for COVID-19. The good news, and I don't have the actual data, is we only had a few sporadic cases that were positive. And so we'll be far below the % positivity we're expecting a % positivity less than 2%, but that is still to be seen. We have amazing epidemiologists that are calculating that data. And again, that's just to reassure the school community at large, is that even in areas that we know were first impacted, have seen the same reductions that we've seen countywide in COVID-19 activity and transmission, which supports the safer reopening of schools. So I know that there's still a tremendous amount of fear, anxiety, and worry, but we really are shifting to the place that when you see any of the symptoms, unless there was known close contact with someone with COVID-19, any of those common URI symptoms are more likely not to be COVID-19, more likely to be another virus or another infection than COVID-19. That being said, the decision tree that we're sharing with you today is going to be a very conservative tact as we reopen some of our larger school districts. We want to stay vigilant even in our own approach. As a parent and as school staff, I experienced it today. It is a frustrating, burdensome process to get your child or yourself tested if you develop these symptoms. But we do think that as we open the larger school districts, we need to, again, stay vigilant, stay conservative in assessing for COVID-19 activity, so we can keep the statistics that we've shown you before, that we really have done a good job of. Even when COVID-19 does enter the school environment, we have demonstrated that we can contain it, and that's what we've been able to do. We're not mitigating, that's the other fancy word. We actually have demonstrated that we can contain COVID-19 when it does enter the school environment, and that's because of the screening, this school site specific protection plans, and all of our behaviors from face covering to maximizing physical distancing when possible. So that's it. Yay, the school and family handbook. Your just thanks again to the Marin School Nurses Organization. They have been troopers bearing with Dr. Willis and me and our team finalizing the school and family handbook. It is now finalized. We're getting it translated into Spanish. It's going to provide very detailed explanation of what parents and families and guardians need to do to keep our schools safe as we reopen it. Again, that we really appreciate. It's going to shift a lot of responsibility and burden to parents, and there will be frustrations. This is a county-wide approach, so it's not every school district is expected. It may look different when you see it in your schools, because we want schools to make sure the messaging meets as consistent with the culture and the style guides, but the public health guidance will be the same across all of the school districts, both private, public, and parochial schools. The only thing, we are planning this to be updated as quickly as we enter into tier 3, which the earliest that could be would be October 27th. This, again, this handbook has the very strict measures around student exclusion for symptoms that, even symptoms that are less common for COVID-19. And we will prepare for updating that as we, by October 27th. And that, we already are going to be sending Dr. Willis the tier 3 recommended decision tree, which is the only, which is the primary change that will be in the updated version. My plan is to get that to him today, so our poor nurses don't have to deal with waiting a very long time again to get this turned around. So this is our masterpiece. It's going to be way too much for you to take in on this meeting, so I'm not asking you to do this, but this is going to be, you'll have the scenarios in one hand and the decision tree in the other hand. And I just want to thank again all of the school nurses. They all participated in getting this final, correcting our edits. We have an amazing schools team, our nurses, and Anita Kennedy, who's been an amazing support for us. I'm obsessive and wanted those arrows to be all the same size. And we had help getting there. And this is really for both parents and staff. So it doesn't matter if a student or a staff is presenting with the symptoms on the left-hand column or has close contact. Everyone needs to follow the same decision tree to determine whether they need to stay home and isolate and get tested for COVID-19, if they need to see a healthcare provider and identify if there's another diagnosis that could be causing the symptoms. Most importantly, it's also about the disposition of siblings and other household contacts. So this is a very strict approach. Again, we're not going to have time to go into it today. This is you're getting the first official viewing of this. We will post it, we will share it, and then we'll make time when we meet next week as we get questions to review it in more detail. But this is the first light of day. So thank you, everyone. And probably the key message is test or 10. When kids have symptoms that are the more common symptoms of COVID-19 at this time, they have to get a test for COVID-19, or they'll be treated as a presumptive positive, that's what we call it, and have to isolate for 10 days. So that is, again, that's a big burden. We realize that this is, there's equity implications of ensuring access to testing, and I'm just really appreciative of all of our federally qualified health centers who've been partnering with us to ensure that all children will have access to testing for COVID-19 so we can get them back into school as soon as possible. So that's it there. So thank you again for everyone for getting us there.
Yeah, and so Lisa, thank you for that. And as our team reviewed this decision tree chart, you know, what we realized is that for the families and, you know, kind of at the school site level, we're kind of looking at the left side of the chart, and as it gets further right, it kind of gets more and more nuanced, where either public health or healthcare providers will be providing more specific guidance. So it's not like everybody has to become expert at this, but you can kind of go down your path to a point where you don't understand, and then seek guidance either from your healthcare provider or public health, and we'll become more fluent in this. This kind of blows up into great detail our exposure protocols. And so we can't thank you enough for helping put this out, and we look forward to seeing how it's implemented and how it can be a useful tool for our school community and families. So with that, we're gonna, we're gonna probably blast this out tomorrow morning, I'm thinking, because we're creating a flyer for these two events. Next Tuesday at 4:30, we're going to have a community workshop, and it's really meant for parents and guardians and the broader school community, going into the detail of the family handbook, the parent and family handbook, and kind of going through the high points of it, some of the details, to answer questions. So we look forward to that, and we're going to have one of those high capacity Zoom meetings. So we want to maximize the number of participants who can join that. We'll tape it as well for future reference. And then next Thursday afternoon, there's going to be a town hall, a public health panel discussion led by Dr. Willis and Dr. Santora and Mary Jane, and also the principal at Marin Catholic, Chris Valdez. So we look forward to those, and we'll be sending information about those tomorrow. And I know that there's questions popping up in the chat, and we will get to those maybe when we go through the rest of the presentation. You want to go to the next one? Okay, so this is just a reminder that if you're registered, you should have the kind of backdoor, not publicly released phone numbers to COVID-19. And I really want to emphasize this, is that when you have an exposure at school that you need to address, the public health team really wants you to use the public health schools numbers. There's two. There's one for the weekdays and one for the weekends. And then there's this COVID-19 schools at marincounty.org. So to get in the system for follow-up and contact tracing and direct support, that is the number to call. Or those are the numbers. They're not listed here, but you'll get them as public health liaisons if you're registered, which you all are. Okay, so Janelle, are you here? Is Janelle Campbell with us here today?
I am here, yeah.
I'm so glad you're here, Janelle. I was looking at your chart, and I edited, I put the wow in the middle, because you explained this to us as you were responding to the real-time COVID positive student who rode on a bus. And I'm so glad you can explain to us how you created this chart basically to support your work.
I actually had to draw it out because took a little bit for me to figure out how our MCUE programs got connected in when there was a student positive at a different school site, and really how interconnected we all were. So we were notified by transportation that some of our students had been riding on a bus where the driver had been on driving a route for a different group of students, and one of those students had tested positive. So we actually had to draw it out a little bit to see not only how our students were connected, what information should go out to those families, and were there any other connections that we needed to get out in front of to provide those scenario 2 notices of a contact tested positive. So this is that map of how we worked it out on the connections and where people should have received some of those notices. And what I would say is for us, it was really helpful to think this out, be able to connect back in with the public health nurse who was doing the work on this to check in and say, we think that there should be some notice out of of a contact of a contact. So more than anything, just this is that reminder of, you know, when you do find yourself in a situation of either a student who tests positive or a contact of one of our staff or students, the importance of really looking at all of the facts and getting all of the facts to public health, because there are some of these questions that come up that are not as obvious as a student within that cohort. It really is those interconnections outside of that cohort too, which it's important for us to get those notices out to families as quickly as possible.
Yeah, and so Janelle, as I kind of reviewed these steps in this chart, what became clear, I mean, what we know from our experience over the past 6 months is that we want to make sure we're doing everything we can to provide the right level of notification without going overboard. And our tendency has been with working with public health to probably go a little bit overboard because we'd rather over-inform than under-inform. We want people to know. But the biggest distinction here is the scenario 2 communications versus the scenario 3 communications. And the public health team came back to us just last week and had some changes to the scenario 2 and scenario 3 communications that was kind of a banner at the top of the letter. Informational only, the class remains open for scenario 2. And then the banner for scenario 3 is COVID positive confirmed, classroom is closed, or, classroom shifts to remote learning, but making those two distinctions really clear. And then I know that, Janelle, there was also something that came up this week where there was a student who had symptoms, but and was being tested, and so symptoms being they had a fever. So do we notify staff when a student has a fever?
Well, for us, the staff were aware because the parents had shared it with the staff. I think the more information we share, the better. I think it just is in everyone's best interest to have information. So there's not a letter per se that we have with a scenario 1, but there are times when our staff has wanted to be able to share that information out with families because they thought it may be important.
Yeah, and what I want to say is that has been our practice early in the pop-up childcare, and it's just for information. So, and then the kind of domino effect is if there's a student who has symptoms, and the parents let us know, our staff know, but then what about the itinerant staff who may have visited those rooms? Hey, just a heads up, FYI, this student had a fever, they're being tested. There's no direct action. We just wanted to let you know. It's a courtesy, a notification that's not required by public health. It's not even a contact of a contact. It's just someone had symptoms that are happening more now because of the time of year that we're in. So I just want to thank you for that overview. Okay, so we're going to go. Thank you for that overview, Janelle, of the bus scenario. So just a quick update on our school status. This is really our estimates. It's actually as of a week ago. And the honest truth is, you guys, it's hard to stay up with the day-to-day activity because we don't have a formal way of gathering daily attendance from all the private, independent, and parochial schools that are operating. Obviously for MCOE, we know how many students are in our special education and alternative education classes. There are 16 public schools that are now offering in-person instruction in some form. Some are fully open, like Nicasio and Laguna and Lincoln. Others are starting to do kind of pilot, partial hybrids, and like this doesn't include a couple of the Kentfield schools. Basich and Kentfield Middle School are doing what we would say pilot hybrids, but it's just a very small number of students. So in addition, the number of students participating and the number of hubs that have grown for our student learning hubs has grown over the past couple weeks. So we know for sure that about 6,000 students are currently in class learning beside their peers and educators or adults every day, probably more than that, but that's about as close as we can get. We can go to the next slide. And this again was as of a week ago. It's probably a good 30,000 or more number of student days added onto this. So we're probably well over 100,000 student days. But the challenge for us really now is keeping this as accurate as we can, which we're not as focused on at this moment in time. We're trying to help support those schools that are beginning to operate and to support our public health liaisons. So we can go to the next slide. So just briefly, again, this is a slide we've shown every week. There's two liaisons per school. We've been having these weekly meetings. We'll work with public health to see what kind of regularity we'll continue to have these meetings based on their availability. Certainly we can host them, every other week or what we determine might be most helpful. Knowing the protocols, now your new homework is to get to know the student and family handbook and the decision-making tree and be able to support staff and families at your school site to follow those. And maybe most importantly, initiate appropriate school communications and provide the critical information that public health needs to do their work in contact tracing and containment that Lisa talked about. And the two trainings that we did in August and September, as well as these weekly meetings, are also videotaped and available on our website. Okay. This is a quick picture of these documents, and essentially the two new documents that were created today really are this document with an incredible amount of detail that will help us all support the health and safety of our student, staff, and community. So, but get to know these if you haven't. These are on our website. There's live links to the template sample communications that would go out to families and staff. Okay. And once again, as schools begin to offer site-based classroom instruction, what we ask you to do as public health liaisons is to inquire and engage your multidisciplinary task force and to seek out input, concerns, questions. What do you need? What do you need to feel safe? What's missing? How can we make our plans more effective in supporting the safety of our students and staff? And that multidisciplinary task force, which you should be a part of, is a critical component of the whole process of opening our schools. So we encourage you to know your site-specific plan, to engage your task force, and to keep making it better. Okay, so we've reached that point in our meeting where we're opening it up to questions. Ken, you said that were you able to pull out some of the questions from the chat box?
Yes, I was, and I'm happy to go through those if it's helpful. And it's really interesting as we are now dealing with a lot of real-time questions with students back in many of our private schools and in some of our public schools, and with public health liaisons interacting with staff. It's interesting to see the questions that are now coming as real-time experiences. So we've got the great public health team here to assist. So let's maybe dig in. So this is a liaison that is saying we have a cold virus going around our school and a staffing problem due to 3 days waits for test results for our employees. Can we access more rapid testing or even stat test results for school staff members? Also, many of the testing sites don't have same-day appointments, so there's a delay in getting the appointments. Please advise.
Yeah, so is Dr. Santora still here? She had to step away.
I think she had to step away for a moment.
Okay, no problem. Well, here's what I want to say is that the testing timeline and availability has been one of those things that seems to change with the wind. And there are times when you can get a same day appointment. There are times when working with public health, our schools team, they can help to facilitate a more immediate test, particularly when there's a COVID positive. My experience directly with Kaiser is that when there are when you have symptoms, you can generally get a test fairly quickly. Working with your primary care physician, and it may take a call to a nurse, to the Kaiser nurse. But I guess I just want to acknowledge that there are times when you can't get one the same day or the next day. Any of the public health team, Sandra or Marcia, do you have any other suggestions?
Well, Sandra, do you want to take this?
Well, I guess we're looking sort of at two issues. One is the availability of rapid testing. And that's been a problematic thing because the rapid testing requires special equipment that's not widely available. So it's not something that we've been able to roll out easily. And a lot of other institutions are having the same experience. There are also some issues around reliability with those kinds of tests. The issue of the speed at which you can access testing and then the length of time the test comes back, it is very variable. It really goes up and down as demand waxes and wanes. And it can be very tricky. We do have, I'm wondering what testing resources people have in hand. For example, Marin Community Clinics offers free drop-in testing. It doesn't matter if you're a client of theirs or not, every day, every weekday plus every Saturday morning. So that's always sort of a good backup option for people who are having difficulties accessing through their regular healthcare provider. There are also a number of other drop-in events that happen each week in Novato, in Point Reyes, in Marin City.
So Sandra, is it the case that, the HHS website, in my experience, has kept a pretty up-to-date testing resources link about all the different ways you can get tested? Do those services that you just described with the Marin Community Clinics or the localized testing resources, do you think they're up on the website right now?
I think so.
Yeah.
I believe so.
So what we'll do is we'll send out, I think that's the anytime that we have a challenge with tests, or we have any of our school community have asked us about testing, we direct them to that website in addition to their primary care physician. And if it's a COVID positive experience, if it's COVID positive confirmed, then the public health team has gotten us same day testing across the board. So whether it's at Kaiser or at another location or color. So does that hopefully that answers the questions. We'll send out the link in a follow-up to this meeting. We'll send out the link to if you go to Marin County HHS and say COVID testing, it'll lead you to the page. It has all of the up-to-date information.
Yeah, sorry, am I able to just clarify a little bit on our question there? I think it's not a COVID positive, it's that with this decision tree, anytime we have a staff person with a new onset cough or that getting those types of symptoms quickly tested is creating a scenario where we're without teachers.
Right. Yeah. So it's a really good point, Sarah. And so we're working on some strategies. There's some new testing technologies and turnaround times that we're working on right now at MCOE that we're going to be sharing with districts that will have them readily available in our hands. But we're just in the process of getting that started. I think the way the law is written now is that if you're an essential worker, a school employee essential worker, that your healthcare provider is required to give you a test. And I would say that if you have symptoms, then they should be able to get you a test in the same day or the next day.
Great.
Yeah.
It sounds like it's somewhat with the wind, but thank you for that.
Yeah.
It is. Also, if this isn't something that we can do for every sort of symptomatic teacher that comes along, but we do have a very few drop-in slots at the color site each day that we can access. And if you have some kind of extreme situation where the cohort is teetering on closure, opening versus closing, or there's a real significant exposure, if you have like 1 or 2 people that need to get put in for testing in an expedited way, we can help facilitate that. But obviously that's not something we're going to be able to offer in most situations, but it is something that's sort of a backup that's available.
Great, thank you for sharing that.
If I could also add, color's going away November 15th.
Yeah.
We're starting to prepare facilities and schools to understand that that's not going to be an ongoing resource. Dignity Go Health in Mill Valley is a rapid screening site. I don't know about the availability of the appointments. And we have had some situations with parents where they've done the rapid screening for travel. And we had a positive child who then they went and got the DNA PCR test. And what we came to realize is that when you have a rapid test and it's positive, we are going to consider it positive. We're not going to, there will not be a follow-up negative test that then voids the previous positive. The positive is positive. And not all rapid tests are created equally. So some of them have higher false positivity rates than others. So I know that just sort of complicates the issue just a little bit more, but I think it's helpful for you to understand that a rapid test may not be the solution that they're looking for.
Great, thank you.
You're welcome.
Okay, Ken, do you see some other questions that have come up we can address?
Yeah, I do, Mike. There are a couple of questions about the decision tree. The one is to just confirm that the decision tree that was shared today is for tier 1 and tier 2, not tier 3.
That's correct.
Yeah.
Okay, and then related to this same decision tree, I'm curious about the bottom right-hand corner from bright yellow to purple. Why, if you receive a COVID negative test, must you also complete a 14-day quarantine?
I think that goes back to the quarantine and isolation recommendations, that the incubation period for COVID is 2 to 14 days. So most people start to show signs of infection 5 to 7 days after exposure to an infected person. And that's why we recommend waiting that long to test. But getting a negative test does not bypass the quarantine period. You could still be incubating the virus and it may not have multiplied enough in your body to trigger a positive test yet. So you have to complete the 14-day quarantine.
Okay, thank you.
Oh, here's an anecdote from Katie Foster supporting that.
Yeah, so Katie, I think it just popped up on my screen for a second, but we had a teacher who was quarantining for 14 days and on the 13th day had a fever, was tested again, and they were tested positive. So, you know, and
Thank you, Katie.
Yeah.
Thanks for that real world example there.
Yeah.
Speaking of real world, this has actually come from a few schools that are now doing some in-person learning. We've had students with stomach aches. The information from the CDC regarding GI symptoms includes nausea, abdominal pain, vomiting, and diarrhea. The CDC information is the only place that we've seen abdominal pain listed. Is abdominal pain or stomach aches a COVID symptom?
Everything and nothing is a COVID symptom, as it turns out. I believe that we did not include abdominal pain in our, now usually people have diarrhea, nausea, vomiting. They will have some abdominal pain as well, but there's certainly a lot of other reasons why a person could have it. And I believe that we didn't include isolated abdominal pain without any other symptoms on the decision tree.
Yeah, it's got diarrhea, nausea, and vomiting, but
That should cover it, right?
yeah.
Okay. Ready to move on?
Yep.
We've been asked to get an explanation from public health as to why siblings of directly exposed students don't need to quarantine and specialists do. We think a lot of people are concerned that siblings of exposed students would be very likely to contract COVID.
You know, the specialists are a direct contact in the case that we're thinking about, whereas the siblings of exposed students are contacts of contacts, which puts them out a tier from where the specialists are. So we don't generally recommend quarantine for contacts of contacts unless the original contact tests positive or develops symptoms or something like that, which sort of changes the scenario. But that's just sort of where we draw the line, contacts of contacts. Because otherwise it just kind of keeps going out in concentric circles until you have the whole school out and testing and.
Okay. This is one that's come up a few times in the past, and likely again as we hear about states and other parts of the country that are seeing surges. It revolves around limiting travel. Do students and staff members who have traveled need to quarantine if they've traveled to other cities or states?
There is no recommendation or requirement, I should say, that they quarantine. We are learning that the activities that people engage in, either here or while traveling, are much more important, and that the sort of biggest risk has to do with large social gatherings. So if people travel and go to a large event, that's much riskier than someone who traveled and maintained careful distancing and masking while they were doing that. And the risk of that traveler is less than someone who stayed home and went to a big gathering. So we don't try to parse out every family's risk factors based on where they live, where they travel, what events they attend. We are just hoping that everyone in our community is adhering to the guidelines to stay close to home, to mask, to distance, but we are not finding it fruitful to try to intervene in that particular way and quarantine travelers.
So I see there's some specific questions about scenarios, and these are good. And I think that what is most helpful, I think, is to address actual scenarios as they come up and look to public health for guidance. But this is one that, is an interesting question. If a subject teacher teaches a cohort 4 times a week for 40 minutes, test positive, do those cohorts have to close and quarantine? So the way I'm reading this is if a subject teacher goes to 4 different classes, teaches 40 minutes, and they test positive, those cohorts have to close and quarantine.
Yeah. Seems like it's kind of an unfortunate scenario, and why we hope that schools will have some mechanism for limiting the number of cohorts that teachers come into contact with. But I know that in some settings, it's just not that easy to do that, particularly in the middle school and high school programs.
Yes, thank you, Sandra.
But they are contacts of each other.
Yep. Okay, other questions that have popped out at you, Ken or Melina?
There's a question about why sometimes it's a 10-day isolation or quarantine and other times it's 14.
The isolation refers to when somebody tests positive, and that's a 10-day isolation, and that's 10 days from the onset of symptoms, or if they didn't have any symptoms, 10 days from when they tested positive, and that concludes their isolation. The quarantine period is not for people who test positive. Only people who haven't been tested or are negative are quarantined. And that's a 14-day period because it allows a little extra time for the incubation. The person who's tested positive and gets isolated has already done that incubation period, so it shaves off some of the time. But a quarantine person may just then starting to get exposed, and they need the 14 days to show whether or not they're gonna have the virus or not. So they're really two separate things, 10 days of isolation and 14 days of quarantine.
Thank you. Is there any additional information about the importance of eye covering related to COVID-19 when inside?
I'm sorry, I don't have any information on that. Marsha?
Yeah, that would only be important if you are doing direct care with a positive person. That's the guideline we're using in healthcare. So you are going to want to see a face shield at your dental office. You are going to want to see a face shield on somebody who's doing aerosolizing procedures, nebulizing, CPAPs, those sections, those kinds of procedures, then you really should have eye covering. Otherwise, I just know personally, I like wearing my glasses in public. I've always preferred to wear glasses because I always want to protect my eyes. I mean, just a general thing. I would say it's not a bad idea if you're really worried about, COVID, but it's not a requirement.
Yeah, and what I would add is that we have in most of our classrooms now, in addition to disinfectant or sanitizing wipes, we have a spray sanitizer or disinfectant, and we require staff, as instructed on the products, to wear safety glasses if they're spraying that product and wiping things down. So we have those glasses there available for staff as well.
Okay, here's two questions that are very related to the work of a liaison at schools. One, if we're asking, and they're sort of related, so I'll do them both. If we're asking parents to do the health assessment at home before bringing their student to school, do we as the school need to have documentation of the results on file? And then the second question, is it still recommended that we take temps at school if the parents are supposed to be doing this at home prior to sending their children to school?
So I would start with your site-specific safety plans. I haven't read everybody's specific plans, but I think every school probably has a process for collecting or keeping that information. I would say as a healthcare provider, if you get a positive response, that you would ask for that. And I don't know, Sandra, what do you think about that? To have that on record if you have, say you have a child with frequent fevers.
Are most people using like online apps for the parents to fill out prior to school? Or
So
is it
Sandra,
kind of-
yes. So here's what I want to say, because I know this for our pop-up childcare, for our spring pilot, for our summer, moving into our fall. It changed over time. The current guidance is the screening's got to be done at home. You're not required to do a screening at the school site. We used to have these table check-ins where there's temperature checks and there's a written, we're not doing that anymore in our programs unless the teachers really want to. There's a handful of our special education teachers who prefer to do that to be more thorough and safe, and that's acceptable. I think, Katie, you're doing it at Marin's community school. So it's optional, it's not required by our current guidance.
Yes.
And so obviously if it's not required, then there's no need for documentation. It's just ensuring that you're, have a clear expectation among your parents that they need to be doing it at home. And then if you're doing the screening, then I would say a documentation is good to have that you've conducted it.
Yeah. Thank you, Mike. I think that's
Yeah.
the best. Yeah.
You know, we have a couple of comments on different types of apps and software that people are using for this. If people would like to send us what apps they are, and you could send it to rapidresponse@marinschools.org. We'll put together a little sheet for everybody for all the liaisons with the different options.
Perfect.
Okay. That's great. Yeah, it looks like there's a lot of people using some different tools to do that.
I would also add that if you have a child that starts to look feverish during the day, you want to have the ability to check their temperature, right? Because
Yeah.
you can develop illness at any time. So, and we all know what a feverish kid looks like, glassy-eyed, pink.
Yeah, and so even though we don't require in our classrooms, again, following the guidance, a temperature check, all of our classrooms have no-touch forehead thermometers so that teachers can conduct spot checks if they're concerned, or even just as a matter of practice. So this is a question I see from Kevin Finn. Does a student who is in direct contact with a COVID positive person need to quarantine for 14 days regardless of a negative test result?
Yeah.
Yes.
Yeah. And this is what I want to say, Kevin, and to everyone, this has been the most kind of controversial, because parents are like, hey, my kid's negative. Why can't they just come back to school? But public health says, no, you've been in contact with a positive. You have to stay home for 14 days since the last known contact.
And Katie's comment about the 13th day, last hour fever and positive test indicates, yes, exactly that. 14 days is the minimum required.
There's another question here about, what should we tell our preschool families that are traveling by airplane during the holidays?
Don't go to any big social gatherings.
Yeah.
Get to your destination.
Yeah.
Stay
And
with
even
the crowd.
on the plane, wear your face covering. And
Yeah. They'll make them do it on the plane.
yeah. So one thing, we've got a few minutes left here, and I don't know, I think we've hit all the questions that I can see in the chat box. One thing that I want to just emphasize is that as a non-healthcare professional, when I look at this, whoops, there it is, or as I read through this, it can be a little bit overwhelming. But having been through some exposures, confirmed or potential exposures, what I want to say is that these documents will, once you're focused in on the actual thing that's going on, these documents really help kind of guide you. And then you can come up with what you think is the answer, and then you give Sandra or Marcia or the public health team a call, and they will confirm or adjust your thinking to support taking the appropriate action. So just know that there's so much detail in here. When you first get it, it's okay to be overwhelmed a little bit. But just know that it is a great reference, and you can go right to the situation that's being described. The other thing I want to say is these are written as templates, and they really are meant to be either a standalone handbook that districts may send out to all their parents, or it may be, incorporated folded into the existing handbooks that parents already have. So it may look a little bit different, but the information will be the same. It's like put your district name here. Welcome back, Dr. Santora. So
Sorry.
yeah, no problem. So I think that we were able to get through, all of the detailed questions about specific concerns. And what I was just emphasizing is that, these two documents that will be released tomorrow will really help. And right now, the way that they're written for Tier 1 and Tier 2, it will be the case that many students will have to stay home for things that they likely normally wouldn't necessarily stay home for. And that's going to be expected. It's going to have an impact, and we're going to learn from it and adjust to it as the transmission rate lowers. As we get into a higher tier, we will be adjusting the direction. The public health will be adjusting the direction. Is that fair to say?
Absolutely. I'm drafting right now the version 2, which is that Tier 3 version, which will be more exposure driven, known exposures to really drive that, where when we're widespread and substantial, we're not being known exposure driven. We're looking at symptoms. And I think that's going to be a shift. Hopefully it comes sooner, hopefully it comes within 2 weeks. So this burden that's going to be shifted to schools and to staff and to parents will be shorter lived. But we also need to prepare, because COVID is its special self, that will move into more relaxed requirements for school entry. And then we go back to a red zone where we would go back to being strict again, until we have data. And this is also true. The more data we get, every day that schools are in session across the nation and across our county, we're getting more data on school-based transmission. And again, all the early indicators, especially for elementary school students, show that it's not a super spreader environment, that we're not going to see COVID spread in the school environment, and which would allow us to relax, again, that criteria. But again, I dealt with it myself today, was not expecting to spend my day with 2 kids at home with fevers that I highly doubt they're COVID. I would put 99% chance it's not COVID. And I know I'm privileged, and that's the hardest part while we are really working in partnership with our federally qualified health centers. I am privileged. I was able to get my kids tested. I have health literacy, computer proficiency, got them scheduled and in. That is not the case for the majority of our kids. But again, part of our role is reassuring the entire school community that it's safe to come back to school, so we can show even stronger numbers. And I think our numbers are already really strong, but show even more impressive numbers that yes, we can absolutely contain this disease. It will enter the environment. We will contain it. And we're being conservative to begin with. So the fear, worry, and anxiety that is still existing among many members of our school community, they can build their confidence and their competencies and get them prepared and back into school.
So Dr. Santoro, we can't express how much we appreciate the approach that you have taken from day one of erring on the side of caution. And I know that is what your team has done and is reflected in this work that will go out to the community today or tomorrow. And I learned new terminology today, and I would say that your kids have a low pretest probability of having COVID-19.
Yes, they do.
Yeah. And, and I also want to make sure that everyone on this call has next Tuesday, October 20th at 4:30 on your schedule. We'll have a 1-hour community workshop that will be an overview of the new Student and Family Handbook for COVID-19 safety, as well as the decision tree for schools. So thank you very much, everyone, for being here, for your great questions, and for all the work that you're doing to support our children and students during this challenging time, and the health and safety of our entire community. So thanks, everyone. We will be in touch soon. We'll follow up with some of the information that was requested with regard to tools, and we will be in touch about this ongoing discussion with our public health liaisons and our public health department. Thanks, everyone. Have a great day.
Thank you.